Okay, so my skill demonstration for this video will be the indwelling catheter on a female. So I'm gonna knock, wash my hands for at least 20 seconds with warm water and soap, provide privacy, identify my client with two identifiers. So full name, date of birth are usually the ones to go for. I'm going to explain the procedure. So my patient's laid down in here. I'm going to be inserting an indwelling catheter. I'm going to ensure that I have enough lighting and that my patient is safe and that they have enough privacy, that if there's a curtain to pull it off, and if the door is open to make sure that it's closed. I'm going to cover my patient from the top and just leave that one area open. I need to assess patient and the perineal area to make sure that if it needs to be cleaned, to do that beforehand. I already opened my case here, so I don't know if you can see that. So here's my bag. So I'm going to open it here. So make sure that I wash my hands prior to it. So I'm going to open it away from me. And then to the sides. Just grabbing the tip of the corner here. Make sure it stays open. So this whole inside is sterile. So these are my gloves. I need to so gloves away. So I can touch the inside of my glove, but I can't touch the outside. And if I need to fix that, I will do it once I have my gloves on. Okay, so now I can fix it and rearrange this, and then I can set this aside. So this is the drape that I would put over my patient and make sure that I'm covering it. So I will just put it on that over there. And then the next one is what I will put. So that is what I will put underneath the patient, underneath their bottom and their legs, so that I can actually work with the area here. So that way I can have this. So like this is my table here, my patient's over here. This would go underneath the patient, and that way I can work in this area. So I would pull this here, and this is what I will put on top of them so that I can leave that side open. Not a lot of people use that. I believe you said that in our skills demonstration, but if it works, we should use that. Okay, so then after that, I'm going to open my swabs, which are right here. So I'm just going to open them. And there's three swab sticks here. I would make sure to grab one and clean like the right side of the labia, and I would dispose of it. I will use the other one to clean the right side of the labia, and then this one would just go down the middle. So all down the middle, and that's just to keep everything clean and make sure that it's antiseptic. After that, I am going to prepare the lubricant, which is right in here. This is my garbage. So the lube is right in here. I'll place it back in here. And here's my indwelling catheter. That's the cap for like a urine sample that I'm not going to be using, but so here's the, I'm going to put it on this side over here. I'm not going to be using that part. And garbage. I'm going to insert this in blue here. Have it ready for me for when I'm going to insert it. So there's that. Another thing that I could set up right now would be the water for the balloon. So I can just go ahead and put this in here. Okay, there's that. Alrighty. So, and just for the demonstration purposes and because of my camera, I'm doing it on this side, but since I'm dominant with my right hand, the correct way to do it would be for me to be on the opposite side so that I can insert it with my dominant hand. But I'm just going to say that I'm doing it with my right hand even though I'm going to be using my left hand. So with my non-dominant hand, which would be my left in a real simulation, I would open hold on, I got lost here. Yes, open the labia minora to expose the urinary meatus, and then after that I would use the right hand to insert it down. I would also make sure to have my patient bear down while I insert the catheter into the urethra. I would advance the catheter until urine starts to flow, and after I get some urine coming down my catheter, I would keep going at least 1 to 2 inches further in, and then I would then inflate the balloon. I'm not going to do so, but once it's already in there within the 2 inches that I already put in, I would make sure that the balloon is inflated, and then I would gently pull it out to make sure that it's good in there, that it's not going to slip back out. So after it's already there, I have urine coming down. I'm going to get rid of this. The balloon is going to inflate, and I can get rid of this. After that, I need to make sure that I have like a leg band to strap my catheter to my patient's leg, as it avoids it being pulled down. I will clean up everything. Let me just get rid of my gloves. I will. So this is all my garbage. I will clean my hands, wash my hands, and then put another set of gloves and just clean up everything and get rid of it. After that, I will document my procedure. I will make sure to document the right output, and if it needs to be documented, I would have to document the color of the urine, the frequency, and